Hello, I'm Dr. J.E. Williams. Welcome to my quick takes for October 7th, 2021. I'm the author of Viral Immunity and Beating the Flu, and I've been studying and writing about viral diseases for more than 25 years. I treat patients every day with acute and chronic viral conditions. The quick takes for today are how to tell if you have COVID-19, a cold, or the flu. This is the flu season, and we are right in the beginning of it for this year. It doesn't look that bad. Last year was almost nothing. This year looks similar to last year. The fall flu cases are very low in the southern hemisphere and now in the northern hemisphere. You want to know what's going on in your area by going to the websites for your state, a county, or your city. And they will have a section for influenza with charts and statistics on what's going on. In Florida, we have Florida Flu View, and for the last 10, 20, 30 weeks, the cases have been very low. In fact, for the last 15 weeks have been extremely low, like last year. That's good news. We want to make sure that you're not having dual COVID-19 and influenza infection at the same time, or some other virus that's going around. It's difficult to tell by symptoms alone what you have. That's really important. You can't guess during a pandemic. You have to know. And because the dominant variant now is the Delta variant, which is much more contagious and more severe in susceptible individuals, you want to know as soon as possible what you have. Therefore, I advise testing within the first 2 to 3 days if you question whether you have COVID-19 or not. Symptoms are similar. You can tell by symptoms alone. There are some that are different, as you already know, like the COVID toes and the loss of sense of taste and smell. However, with the Delta variant, those symptoms are less common, therefore harder to tell than the previous variants. And also the sore throat, the runny nose, the headache, and the fever, though still common and also common with influenza, could be worse. Fatigue is a universal symptom of acute and chronic viral infections. It could be more severe with COVID-19, but difficult to tell. If you know that you've had exposure at work, at school, or at an event, then by all means get tested. I recommend the rapid test. Drive-through tests are still available. They're nasal swab. You'll know within 2 hours. They're mostly accurate. My diagnostic protocol to know if you have a cold, or flu, or RSV, or COVID-19. 1. To note and evaluate your symptoms. Read my latest blog, which will go over the symptoms of cold, RSV, influenza, and COVID. 2. If you suspect at all that you have COVID-19, and especially if you have definitive exposure, get the rapid nasal swab testing. If it's negative, then treat it as you had a cold or the flu. And 4, lastly, if you're unsure within those first 2, 3, 4 days and your symptoms are getting worse, whether you have COVID or not, then go for a multi-target test panel. Both LabCorp and Quest offer these. You can order them on your own through my website, or have your doctor order them for you. They're called the SARS-CoV-2 RNA, Influenza A/B, and RSV qualitative panel. You'll learn from This tests whether you have influenza A or B or RSV, another respiratory virus that's becoming more common, worse in young children and the elderly. And if you have SARS-CoV-2 or you have a cluster of more than one virus. It's a great test. It's very accurate and now available. And your treatment. First, make sure you test. And if you're positive, self-quarantine. Don't go out. Practice social distancing and mask up if you have to go anywhere. Then start self-treatments, including rest and fluids. Most importantly, take the basic supplements. Pick up your dosages of vitamin C, 2, 3, 4, 5, 6, 10,000 milligrams a day. Zinc, 30 or 60 or 90 milligrams a day. Selenium, several hundred micrograms a day. And then add the herbal antiviral, antimicrobials like echinacea. My recent article on the 10 top supplements for COVID outlines these in detail, especially if you're sure that you have COVID-19. Follow the recommendations on my website. It will help. And most importantly, if you have COVID-19, you tested positive, and your symptoms are very strong, high fever, body aches, you're just feeling terrible, consider monoclonal antibody therapy. I recommend Regeneron. My patients have done extremely well, recover quickly, and without any lingering side effects. You want to know ahead of time where the entry for evaluation for the monoclonal antibody therapies is in your area. That could be at the hospital or could be at a large private clinic, and you'll find that on the webs, not on my website, but on the Regeneron and the monoclonal websites or your county health websites. Lastly, best thing is to avoid infection and stay well. Remember, if you don't get exposed, you won't get infected. If you won't get infected, you don't get sick. If you don't get sick, you can't spread. Thank you. Be safe.